the topic today?
We're on? Oh. What's going on? Carolyn, dying over there. What's going on, everybody? This is Dr. Schilling from Secoya Health. I don't even know where I am anymore. I blacked out. Bringing this week's Wednesday Wellness Minutes, and Anissa surprised me by turning on the cameras before I was aware of what's going on.
You said you were ready.
I did say I was ready. I apologize. I take full responsibility about that. Amelia, no chiming in from the back there. All right. So this week we're going to talk about ditching the diagnosis, as we've stated on the description. And what I'm about to share is an example I heard off of National Public Radio related to a condition that is very real for some people. So the idea is not necessarily to dismiss your symptoms, what you're experiencing. It's really about dismissing the idea of that it is limiting you. It is what defines you. Because some of the people in the story actually felt like, oh my gosh, this is me. This is what I have. And the challenge is that what they're experiencing is a set of symptoms related to a brain pattern they're dealing with, rather than simply not acknowledging it for what it really is. They're treating it as like, oh, this explains what condition I have and helps me understand like where I fit in the world. So this condition is called Misophonia. And basically what it is describing it as, they talk about it, misophonic person is someone who is either driven to tears, into sweats, or into fits of rage by hearing someone else chew, or some type of verbal or oral expression. Coughing, sneezing, clearing their throat, or chewing food. This is literally, if you want to look it up, misophonia, M-I-S-O-P-H-O-N-I-A. That's the fancy term for it. And what happens is their system, their neurological system is going to overdrive. But you always, in everything you're thinking about, you got to back up and say, why is this person experiencing this? Why are they experiencing these symptoms? So for example, the young lady they talk about in here, she talks about she either goes into these crying fits, like she can't, like if she and the family are sitting down for dinner, she will go into crying or she'll go into complete rage, one of the two. And can you imagine how frustrating that would be? So when we think about ditching the diagnosis, we don't want to invalidate her symptoms, what she's feeling, but we want to understand why the symptoms are happening. And with anything, and I'll explain about this in a minute, any type of reaction the body or brain has to an environmental trigger, it's most likely, if not exclusively, due to a traumatic experience earlier in life that was involving some type of auditory, in this case, a sound stimulus. I'll be discussing some environmental allergies in a minute because we're about to enter into allergy season, and of course the people are like, oh, the snow mold. If you've heard the snow mold, it's all the mold that was trapped in the snow as it starts to melt. People start freaking out. Now their reaction is very real, but they are yet to understand why it's happening. So when you think about this young lady who is suffering from this misophonia condition, her limbic system is getting fired up. So inside of her brain, there is a panic reaction. She goes into fight or flight when she hears someone chew food. It could be someone chewing food, drinking water, clearing their throat, as we discussed. So I suspect, based on what I've seen through working with thousands of people, is that at some point in her life, and it could have even been in utero, and this could even be a generational stress that is now being triggered. We don't know exactly what her condition is or what she might be dealing with. It triggers because there was a stressful time in her life when probably maybe the whole family was sitting around and there was arguments or there was stress or some type of really stressful time in her life, in this particular person, and her nervous system latched on to every environmental thing that was going on there. The sound of people chewing, the sound of someone drinking, maybe a dog barking. There's no limit to the things that the brain will associate with a particular trauma or stress element. So when we think about this person, we don't want to make them feel like they're going crazy, because that's what a lot of psychiatric professionals will do. This is all in your head. You should just, distract yourself. I mean, they even talk about having your family outings, instead of being family dinners, go on a hike, right? I mean, it's almost silly to think of disrupting everything aspect of your life. So if you have misophonia, or you know someone who does, you definitely want to help them heal their brain. So they need to understand where the traumas are, who the people are involved, and help desensitize their nervous system, because their brain is incapable at this point of dampening down the response that's happening to these different stimulus. So moving on, branching out from here, so her misophonic diagnosis, they talk about having families eat as a buffet. Don't ever sit at the table. Just have everybody go and, sit in a different chair so that this child or adult doesn't have to go in their room or go outside or something and eat separate. Because you can imagine, if you're at all sensitive to sound, if this drives you into a fit of rage, that would be pretty debilitating. You couldn't go to the cafeteria, you couldn't hang out with your friends. You just say, okay, I'm gonna eat by myself, I'll see you guys after lunch, or whatever it is, dinner, breakfast. So this cascades into the different areas of the allergies. So let's segue from this I'm sure maddening challenge from the nervous system relating to the Misophonia condition into environmental triggers, because sound is a sensory feedback to the brain. It's an environmental thing, and it could be someone chopping wood, chainsaw, dog barking, cat meowing, parents screaming, anything can be relevant for this. But because we're entering into the season of the allergies, when I was a kid, I used to get injections in my arm every week because of allergies, right? And what they were not willing to recognize or did not have an appreciation for is that a hyperactive immune system coupled with a hyperactive nervous system, that's a recipe for allergies, okay? So the immune system ramps up really fast and overshoots the mark, so you get a lot of runny nose, sneezing, coughing, runny eyes, things like that. And so when you think about allergies, let's just think about the tissues, okay? So I just highlighted a few because there are too many to count or even describe at this particular time. But let's think about people with constantly running noses, sneezing a lot like that. So when you think of the nose, if your allergy trigger is coming from the nose, you want to think about being offended or something that stinks or something that's offensive, okay? Most people would think of associate with an odor, something smelling like that. But you could be smelling ragweed or pollen or things like that can come in the nose. We talked about things that this young lady, so probably what was happening was things that she didn't want to hear. Obviously, it goes without saying, if you're being overstimulated by an auditory, like a sound in the room, it's of course something you don't want to hear. But take it a little further than that and think about things that other people are saying you don't want to hear, like parents fighting or arguments or whatever it might be, right? It might be even a sibling. It just depends on who it is. People who get allergies with a lot of runny eyes, like a lot of dripping, my eyes keep watering, can't stop watering, we associate that with the tear ducts. And that's somewhere in the nervous system related to needing to be validated or needing to be recognized, okay? So some of this may seem strange, but the sensory lobe of the brain or the post-sensory lobe of the brain, they're pretty important, as far as how they go in the system. So let's talk about some of the environmental things. Trees, flowers, smoke from cigarettes and things like that. It could be campfires and other things like that. It just depends on what stressor happened at the time when the atmosphere was filled with the sound or the smell or the taste or the touch or whatever it might be. So if you think about weeds, people often have an allergy to weeds. It could be ragweed, it could be things like that. This doesn't necessarily go under the poison ivy thing, but I suppose you could put it in there as a weed. But fear that good is going to be replaced with bad. Okay, so something that's good, that things are going to turn bad, if you will. Or that you're not being heard. That can be related to weeds. Trees, like tree pollen, not strong enough to handle life. Like things just seem overwhelming, not strong enough to handle a job or et cetera like that. Smoke from a campfire or a cigarette could be somehow feeling violated at some point. It could have been something taken advantage of. Not too often people have allergies to flowers, but it does exist. So let's think of an oversensitivity. When you think of the word allergy, replace that with sensitivity, okay? Because most everything can be overcome unless, of course, I describe it as anaphylaxis. To that point, even if you have anaphylaxis, we've had people come through here to Secoya Health and have actual, the whole EpiPen carried around with you, can't have dairy, gluten, things like that. We've done brain resets, we've done desensitization through homeopathics and things like that. And then now that they're able to get to the point where they can actually have an actual exposure therapy, where they go to an allergy clinic, quote unquote allergy clinic, where they actually give them the food and things like that, or the liquid, or maybe milk, might be a peanut or something like that. So just as a segue, an aside there. So getting back to flowers, not good enough, not pretty enough, not smart enough, not strong enough, etc. Not enough, not good enough, period. Dust. And each one of these has, of course, an organ system we won't go into, but they have a predominant organ system. So dust can be can't trust others, doubt, disbelief. It could also be not able to get rid of something in life, person, place, thing, some aspect of life you can't get rid of. Thymus, related to mold, which is unable to say no. If you think about people with toxic mold exposure in their homes and things like that, it could be very crippling to feel stuck in that way maybe you're in a rental, maybe you're in your own home and you can't get the insurance company to pay for it, or you can't get the landlord to acknowledge it, so you're unable to change that situation. Animal allergies, right? I grew up wanting to be a veterinarian, and of course I was allergic to dogs and cats and horses and cows and pigs and everything else that walked and talked and breathed. Probably allergic to humans at that point too, but fortunately not anymore. Not allowed, not able to please others, feeling excluded, things like that. And then of course we'll just finish off with grass. And grass comes up as fraud, fear that something that appears good is not as good as it's going to be, it's going to turn bad, and or something about not deserving. Okay? So the basic premise of this segment is really to discuss that you want to get rid of the diagnosis. Acknowledge your symptoms as what your experience is, but don't take off your name tag that says, hi, my name is Susie, and put it with, hi, my name is Misophonia, or hi, my name is chronic rhinitis, which is the sinuses, or whatever diagnosis you've been given. If you are sick and tired of being told you have these different conditions and you want to find the root cause, then what's most important is you find a clinic like ours that's going to help you get to that root cause, because it doesn't have to dictate the rest of your life. It's really important that you understand that there is a reason behind everything that happens. I mean, it's not cliche. Everything happens for a reason. There's a reason behind everything that happens, is a different way of looking at it. So in your body, nothing happens by chance. If it's an allergy, quote unquote, or we call it a sensitivity, if it's a viral thing, if it's a gut bug, whatever it might be a skin thing, it all happens for a reason based on what's happening on the inside. So that body breaks down on the inside before the outside. If you have sensitivities or allergies, the body's overreactive on the inside. Might be in the brain, might be in the body, might be a combination of both. If you're having things on the skin, gut issues, head issues, whatever it might be, everything happens for a reason. So when you think about the diagnosis you've received, it is only an indication of the set of symptoms you have. Okay, Dr. Mark Hyman stated eloquently at one point, diseases don't exist. Diseases are collections of symptoms, which is very true. Nobody had a disease until someone said, well, you have these 5 symptoms, and well, my name is Johnson, I'm going to put this as the Johnson disease on there, right? It just doesn't make sense. So if you back up and say, okay, I have symptoms, my symptoms are a sign my body's trying to heal something, my body's trying to fix something, then you can say, okay, I can take a step back and say, my body's not breaking down, it's not betraying me, it's actually working on something. So don't think of symptoms. I implore you to not think of symptoms as something bad to get rid of. I think you want to consider symptoms are something your body is using. It's kind of like your check engine light on your dashboard, right? Think about it that way. Your body is trying to heal something and it needs help. So it's giving you the sign. Might be a pain in your foot, might be a pain in your gut, you might have a rash on your skin, you might not be able to stop sneezing, whatever it is. Understand that your body's trying to help you understand it needs help healing. So I'll encourage you to ditch the diagnosis, take the ideas, but don't be limiting yourself to the diagnosis, whatever it might be, and then get to someone or some group of individuals that can help you understand the why behind the condition you're experiencing. There's a why behind it, you just need help finding it. Do us a favor and comment below what you'd like us to speak about. We ask you every week. We appreciate that. Next week we're going to be talking about Crohn's disease based on a request from one of our active participants. Excuse me. Because that's another commonly misunderstood, Crohn's disease, ulcerative colitis, and things like that. Very misunderstood. All they have is symptoms. What they're doing is looking at the symptoms and saying, well, here you go, here's your box. You are now Crohn's or ulcerative colitis. I'm going to put you in that box and treat you with these symptoms. You can run by if you want. Oh, you're going that way? All right, cool. That's all right. So just understand that we're here to help. We can get you the answers you want as far as understanding what's going on with you. You don't have to be limiting down to your diagnosis. You can ditch the diagnosis, as we say, and live up to your true potential. So do us a favor and comment below, give it a like, share it with your friends and family so they understand that they don't have to live with a diagnosis the rest of their life. Granted, we talked about allergies, but this spans all areas of life and health. Okay? So we appreciate you tuning in. We look forward to providing more value for you next week for the Wednesday Wellness Minutes. And let us know what you'd like to talk about. All right? See you guys.